你坐这。看。弄上来了吗？好，各位晚上好 ，Good evening everyone。那么今天我们非常的荣幸，请来了多伦多的刘东博士为我们做精彩的演讲。刘东博士在吗？我看不到他。
思堂好。
哎，你好，你好。
林旭好。
那个就开始吧，咱们就开始。
好嘞。So good evening and good afternoon. Thank you for the invitation. So today I'm going to present for the taping, the pen taping for prevent sport injuries. We know we play Tai Chi. The most people complain is the knee pain. When we play Tai Chi, the knee pain, how we prevent the knee pain and how to treat the knee pain if happen, people have a lower leg pain or ankle pain. So we know here the kinesiology tape can be well applied in the sport medicine. So today we're going to discuss some application. We're using traditional Chinese sport rehab technique or the applications. So we apply the meridian or channels. That's acupuncture meridian or acupuncture channels. So we combine the kinesiology taping with the theory of the traditional Chinese or acupuncture meridian system. So there one doctor, one physician in the States, she said the meridian or channel system is 3,000 years ago, is formed the base of a traditional Chinese medicine. Well, the Tai Chi is a part of the traditional Chinese medical exercise. The meridians represent the channel where the invisible, the qi or energy, or the qi, Tai Chi, the qi, the flow. So the life force of the energy. Again, if any obstruction of the flow of the qi can cause the pain, well, they can cause an imbalance in the body. So the traditional Chinese theory is a qi. The qi circulate along the channel or along the meridian. Same the Tai Chi exercise is a circulated qi. So we know some restoration of the qi, the energy of the qi. All is the Tai Chi exercise about. But when the people have injuries, we're looking for the may have some blockage in the meridian or the channel system. A study of a channel system provides an essential basis for understanding the reciprocal relationship and the influence among the various physiological pathology or even diagnosis or therapeutic aspect of traditional Chinese medicine. So the injuries is very common in the meridian system. We have several different meridian systems. For example, in the 12 premier meridians is called sport meridians, network or web meridians, myofascial meridians or sinew meridians, or connected vessels. We can see this picture is from 1200 years ago from Japan. So this meridian is most likely is a biomechanic meridian. So during the Tai Chi exercise, we can train our biomechanic. Biomechanically, so there are 12 premier meridian. The 12 premier meridian is from the front, lateral, and the back. The 12 is relate the body, the biomechanic pathway. In the front, we call the yin channels, and in back, we call yang channels. They'll call yin and the yang. They exactly like a Sitan Tai Chi sample. There are two fish. One is the yin, one is the yang. So they call the Tai Chi is the same in the traditional Chinese, the exercise pathway or channels. So the yin and the yang will also divide the upper limb, the lower limb. So yin is related to the heart, the pericardiums, the lung, and the yin also the kidney in the lower limb, in the kidney, liver meridian, spleen meridian, and the yang meridian. And the yang channels, we can connect the stomach or the energy we call lymph or reproductive organs, large intestine, urinary bladder, gallbladder, or stomach. So how this meridian is linked with the taping? Well, we know the 3 yin meridian is most of the yin aspect is a long channel of hand. Means the yin aspect. Let me turn on my video. Is the internal go is a flexor, is a flexion. Most movement for flexion, either internal flexion, external flexion, or just a flexion. So there's 3 yin meridians. Is most do this exercise. Is a closed chain exercise. So when they have, for example, the tennis elbow, when they are tennis elbow or golf elbow, we can using this tape and use just simple. We cut this tape and then we apply this tape along the channel. Again, there's 3 channels. One is a closed chain to the external rotate, flexion, and the internal flexion. So real we call the tennis elbow or golf elbow. So when they have an elbow pain, wrist pain, we can using this tape, either to support, to enhance, to protect, or release, eliminate, release the pain. So there are 3 yin channels. 3 yin channels is not only the muscles, the ligament or tendon, but also they can represent the organ function. We learned the master. Sitan is my teacher of the Tai Chi. Same, Lin is the master of the Tai Chi on the martial art too. So when they do the exercise, a Tai Chi exercise, for example, Peng, the energy is going to using 3 yang channels. Lü energy is using 3 yin channels. So this is 3 yang channels. And in the traditional Chinese medicine, it represents the large intestine, a Sanjiao channel, or small intestine channel. So we can see from here. So there is a lateral, is a small intestine channel. So this is typical of the golf elbow. Is golf elbow, when the elbow pain, we can simply apply the tape, a tape on the elbow in a certain direction. So there are 3 yang we call Peng, Lü. So is all the Peng, Lü, Ji, and all the Tai Chi exercise can represent different meridians. On the other hand, is the local soft tissue injuries. We can be protect, prevent, or treat in the by taping therapy. So we're talking our yang meridians. We can see this gentleman is all the shoulder meridian. The shoulder is an old meridian name about small intestine. So shoulder meridian. So different application. We're using this black tape. Well, before they have a strength different. Right now, they're not much different. It's all mostly made in China. So the tape so can give you support, protect of a shoulder or elbow injuries. So there's a great, this is from the real sport game. I download from the internet of these pictures. So we 3 arm, we know 3 arm have a yin and a yang side. It represent different body flexion or extension or rotation, inward rotation or external rotation. So any this movement problem or pain, we can use in tape to pretend or reduce some of the pain. So this tape is very simple, very simple procedures. It's just like a bandage. So I have a textbook for this taping. I do encourage everyone after today's lecture, so we can have some tapes, and when we have an exercise or even some garden or even have a knee problem during the Tai Chi, so we work on that. So this arm meridian, we're talking leg yin meridian. Leg yin meridian have a 3 meridian. The yin, the internal leg. Internal leg is a liver meridian. Liver meridian is go to the middle of the inner leg. Spleen meridian is a frontal of the inner leg, and the kidney meridian is the posterior of the middle leg. So the liver meridian, when they have the abdominal aching, pelvic or genitals condition, even menstruation pain. So we're using the liver channel, liver meridian taping. So if people have upper abdominal aching, pelvic, menstruation pain, we can use a spleen meridian on the kidney. So when they have a throat or even ear pain, we can go to the spleen meridian. So the 3 yin, we can show all 3 yang meridian is a frontal, most of frontal and the lateral. So we call gallbladder meridian is a lateral. So any IT band pain, the lateral of the knee pain, lateral rib pain. So we can go to the leg yang meridian of the gallbladder meridian. Or stomach meridian. Stomach meridian, most frontal meridian. Even people have a forehead headache in the forehead, the nose problem, even teeth problem. So we can go to stomach meridian. Urinary meridian, UTI, urinary bladder meridian. So back pain, lumbar pain, even the headache. So all those from yang meridian channels. So we can see from here, very common, people have a sciatica or hip joint pain. So we can use a tape to taping the joint. So their real is a hand-on course. Today, I just have an introduction. So the taping is a very simple procedure. When the people have a hip pain, simple, tape it. The hip pain going to reduce significantly. Well, let's see, this meridian is the long meridian. Is the long meridian, we can see is from the thumb, hand, and arm, go to the chest. So the taping here, real the people have a thumb pain, the lateral of the wrist pain, the lateral of the elbow pain, shoulder pain, even clavicle, and the upper chest tightness. We can go to the long meridian. Long meridian also can open the chest, open the airway. We can go to the large intestine. This a lateral side and lateral frontal side of the arm, and go to the jaw. Any TMJ pain, so we can use the taping to tape TMJ or taping upper shoulder. This tennis elbow significantly, we're using the large intestine. The taping from there. Well, this we can stomach meridian. The stomach meridian is real the frontal, is the frontal of the body, is real in charge of kicking, the kick, the extension. So those stomach meridian is the frontal meridian, is go to the kicking, extending our leg. So they also go to the face and the forehead. Well, spleen meridian. Spleen meridian is the frontal inner side of the thigh and the leg. Is the kicking inward, front and the inward kick. also relate the upper abdominal, spleen, stomach, pelvic, and the menstruation, and the urinary or genital system. So this is a spleen meridian. The heart meridian. The heart is the inner side and the front of the arm. So any tennis elbow or golf elbow, they may have a pain along this meridian. This meridian also can calm the mind. I have been teaching lots of lectures during the COVID. Lots of people have anxious, anxiety, depressed, even panic. So we're using this meridian. So the inner heart, the palm, the wrist, to release some anxiety. It's a heart meridian. And the heart meridian ending to the armpit. So any inside of armpit, the pain, any lateral from the pinky fingers, this is a chain. Again, this is a closed chain. Exercise when you have a pain during this closed chain in the lateral side, we go to heart meridian. Well, this is a shoulder meridian. We call shoulder meridian. The modern time, we call small intestine. We'll go to the shoulder. And when you have a shoulder pain or neck pain, we're looking for the shoulder meridian. In the small intestine meridian, they exactly on the middle side and the posterior, the open chain. Inside the closed chain, this is an open chain. So those for the shoulder meridian, we know any shoulder pain, we go there. This a urinary bladder, any UTI, urinary tract infection, neck pain, lower back pain, leg pain, any pain in the posterior of the back, posterior of the leg. So we go to the urinary bladder meridian. The kidney meridian is a very long meridian from the bottom of the toe to the upper chest, to the upper sternum. So those kidney meridian is very important for the any pain, plantar fasciitis, inner knee pain, lower leg pain, foot pain, inner thigh, the upper leg, inner side, the genital pelvic pain, as well as menstruation. So kidney meridian is the most important for the nowadays because we will walk less than before. So we do need the kidney meridian. So the taping along there. Pericardium. Pericardium is the middle line of the arm and the hand. Carpal pain. Middle spring or strain, the forearm, the chest pain. So we can go taping for the pericardium meridian. a gallbladder meridian. For people who have a temporal headache or lateral side of the leg, IT band problem, sacrum pain, hip joint pain, or pelvic pain, lateral of a rib pain, we all go taping along the channel. And this channel we call gallbladder meridian. The last meridian we call liver meridian. The liver meridian is the last meridian of the 12 meridian system. So any pain in the lower leg, lower abdominal, pelvic or genital pain, urinary aching, or headache, hypochondriac pain. So we can go to the taping along the liver meridian. So those meridians, primary meridian, we associate. They call 12 myofascial meridian system. So muscle and the tendon. So for example, this we're taping about. When the pain along this area, we can taping. There are lots of taping techniques, and taping can be very easy. They just elevate the superficial fascia and then release the pain. This is a long myofascial meridian. Large intestine myofascial meridian. We can see any jaw pain, upper back pain, tennis elbow, upper shoulder pain, clavicle pain, jaw pain, even sinus and the frontal headache. We can tape in this area. It's a large intestine myofascial meridian. This stomach myofascial channels, we can see clearly is a frontal leg, any knee pain, middle back pain, chest tightness, or jaw pain. We can go to the stomach myofascial meridians. This is a tape. Again, tape is a very simple technique. You just have this tape, cut it, and put on there. This is for the people who have a quadricep related to the patella pain. So simple, apply there. The frontal knee pain. So those the frontal thigh pain is a quadricep pain. So when the people have a prolonged exercise or prolonged walking or standing, they may have the frontal thigh pain, and those taping is a very simple procedure. Cut it, apply it. So maybe I can put some tape on Sitan. He looks a little tired. I'm not tired yet. So those, the leg pain. Well, this is yin meridians. This is sinew or the myofascial channel. sinew, another word for myofascia. The spleen channels. We can see the spleen is the frontal lateral of the leg. And it can go to the lateral side of the ribs. This is heart myofascial channels. We can see from a pinky finger in the frontal, middle side, go to the heart through the armpit. This is a shoulder channel. We can, if people have a scapulary pain, golf elbow, so we can tape in small intensile myofascial meridians. Again, this is a urinary bladder myofascial meridians. We can see clearly is all the leg, calf, hamstring, sciatica, lower back, the middle back, go to the shoulder, and then go to the neck. So we can tape along the channel. We can see this athlete, the taping exactly along the urinary bladder channel. So they can make a significant release from their backache, release their back pain. This is a kidney most in the posterior side of the inner leg. From a bottom of the feet, we talked earlier, is a plantar fasciitis, for example. We can using this tape. We can see the muscle when the aching, this side from the inner side, spleen meridian, liver, gallbladder, and the posterior urinary bladder. So either real, either front, back, middle, and the lateral. So we can using this terminology. We follow the traditional acupuncture meridian or channel system to apply this tape. Significantly, people can feel, behold, people feel hold, somebody hold, tight, protect, and the pain is released. Pericardium fascia, myofascia, we see in the middle of the arm, middle of the forearm. Go to the diaphragm area. So any taping can easy breathing when the people have palpitation, panic disorder, anxiety. So this tape is can apply well to release the chi blockage along these channels. This essential channel, sometimes they call the triple anesthesia or lymphatic channels, lymphatic nodes channel. So we can see is from a middle of the extension, So any pain from the shoulder, elbow, wrist, or even the palm, we can tape in here. This is the leg. gallbladder channels taping. And this is the Sanjiao taping. This is the inner side taping, gallbladder channel on the lateral. This is a gallbladder channel. Let me add one more. This is a gallbladder channel. We can see from a lateral knee pain, IT band pain, sciatica, the hip joint pain, sacrum pain, SI joint pain, lateral of the trunk pain, or even breast pain and the upper shoulder pain, headache. So those is the urinary bladder channel. There's a liver myofascial channel. We can see the middle, the channel, can release the tension along the liver meridian. For example, inner thigh pain, distal pain, the big toe pain is a groin pain. So those can significantly release the aching during the sport injury or during the exercise, the pain. So the taping is a very simple procedures. And there's not much allergy, the modern technique. I have been working these tapes over 20 years. And this, I feel, is the most convenient and safe and harm-free for the home care, for people using this tape for the release, the injuries, or protect the pain, can relieve the pain, or for pain relief, in other words. So groin pain, this exercise, this taping is wonderful. So palpation, the meridian. Again, so it's simple. So the pain, we just find where the pain, or find where the pain, and along the pain from the distal. So I open that, put here, from lower to the higher. So just a 1, 2, 3 procedures. I do one more time. We open that. Keep here. 1, 2. For my elbow, 3. There's a simple 3 and 4. Massage it. So if I have a tennis elbow, so I cut I put the lateral side. 1, 2, 3. Go up. Go to my elbow and the lower here. So it's a very simple procedure. I can feel my hand, my forearm is lighter. So those are 3 lines. The 3 lines of a lateral line. We also have a 3 line in the front. So, for example, if I have a shoulder pain, If our shoulder pain, is a simple tape here. 2, 3. So this can release the fascia from the shoulder by taping the forearm. So if people have a shoulder pain, for example, we can see this chart. If upper shoulder, middle shoulder, and the lower shoulder blade pain, we can have a taping this area. Just exactly what I'm taping here. For example, I have a carpal tunnel. If I have a carpal tunnel pain, is along the PC carding. So I taping that, put here, put on the carpal tunnel, and protect myself. Go to the elbow. Meantime, I would have the carpal tunnel, so circular. The circular make a circle. Well, I have a great strength right now. So those are taping technique. So we're using lots of martial art. They use a taping. Because I don't have a demonstration for the shoulder pain, they can significantly reduce the shoulder pain. Even upper shoulder, middle shoulder, lower shoulder blade, or inner side, the shoulder blade spine or rhomboid, this area. So those are shoulder meridians. We did already. This is the forearm, the 3-line, the yang extension, 3-line is the flexor. Simple. Where the pain, we're taping where the pain is, from lower to higher, from a distal to the center, from afar to near, from afar to near, from a distal to proximal, from a finger to the elbow. So those are principle, basic principle of the tape. We can see there's a leg pain or knee pain. So just simple. When they have a long walk, have a sore, the sore of the leg, we can tape in here. On the both sides, front and the back. Lots of people have the sciatica. So those is the basic taping for the sciatica. The hip joint, IT band, we can, the taping simple one strap from lower, below the knee to the hip joint, or even the posterior of the leg and the buttock. Same here, we can see spleen meridian. We can see the fascia by taping here. Liver meridian, go to the genital. Kidney meridian, go to the anus. So those meridian either represent the different body motion or myofascial pathway. So we can simple taping along each pathway. Well, so the taping not only for the sport injuries, the taping also the great application for perinatal care or for people with a pregnancy. This again is a 1500 years ago, the Japanese textbook. Is the original from China, Chinese textbook, but printed in Japanese. All the language is the Chinese language. Those are pregnancies, 3 months pregnant, after 3 or 4 months, people start feel the leg tiredness, soreness, even swollen. So by taping the leg, can significantly release the aching, make people feel lighter, feel better. Well, today's presentation is finished. Next 10 minutes, I would like to invite you. We'll have some discussion. If you have any question, so in next 12 minutes. Thank you, everyone, for listening. 谢谢斯坦，谢谢Lin very much. Right now for the 10 minutes, we can have a question and answer.
How do you tape for shaky, unstable ankle?
Good question. That's a very good question. Let's go to the channel here. When you do the unstable ankle, you have to analyze which side. So we know we have a frontal side, lateral side, and posterior side. So an inner side of our 3 ankles. For example, this is my feet, unstable. You have to analyze which part your ankle is the most weakness. Can you tell me which part of your ankle is weak? Either middle side or lateral side?
Medial.
Very good. So if a medial side, so we're going to cut off the tape. You can see the finger.
Yeah.
We're using 6 different. I use my ankle or my wrist. That's ankles. We put the middle, the tape on exactly on the weak parts. Then we make like a ballerina. You know the ballerina? So the ballerina, so protect. This is the basic procedure for stabilize the ankle to prevent the ankle pain. Very simple procedures. However, if you have a severe pain, I suggest you go to the doctor first. The taping, just when you do the exercise, you want to protect yourself. At this moment, through the online, I cannot give you a suggestion as a treatment procedure. It's only for you protective. Are you clear?
Yes, thank you.
You're very welcome. So you can see like that. cross the chain. Do you have any question? So
I wasn't sure where you would be able to find the tape. Do you get the from a specific sporting goods store or online?
well, my friend, you can ask Lin. I believe Lin have some tapes. Either have the best same sport tape Lin has, or Sitan.
Okay.
Sitan may have those. 斯坦，你有没有这个？还有没有这个绷带了？你的声音没有开。斯坦，你的声音没有开。
我有 ，I have.
Oh, this yes. 斯坦 said he have a few because the quality, because we do have a quality. My goodness, many years ago, I visit their home. I visit their masters, Chen and Master Lin's home. We have a one suitcase of tape.
Oh wow!
很多 I have more. Yeah.
He said he have few. So that means 3 years ago. And the tape, that's first. Tape the weakness first. So you start where the weakness is. Start the weakness first. We always start the weakness for protect. When again, this is just for preventive, not for therapeutic yet. So if someday you're welcome to visit Toronto, my clinic will be perfect. Most for home care, for before or after you do the exercise. That's a great question. Or my clinic in Toronto, Ontario. Maybe someday after I retired, I move your place. I move to the States. Well, another 5 minutes. Let's talk.
One last question. I was just wondering if you would recommend taping to enhance performance.
Oh, for sure. That's the most, the Master Chen is an elite athlete, have a lot of champions. I know him and have a most elite athlete or performer, professional performer, they have some injuries. And this tape is one of the best procedure. I have been working with some Olympians, the world champions, a few world champions during past 15 years in Toronto. So almost every athlete or performers, they have the tape on the stage. So those is a real simple. They're going to like a bandage for every family have those, or every people, no matter the professional athlete, or there are fans just like a martial art, boxer, or Tai Chi player. So when you release, very simple, just release it. After taping, I feel my hand much lighter right now. So those, the beauty of, this is I'm passionate for taping for 25 years already, the tape. So I suggest you contact the Master Lin or Master Chen for the tape. Just from beginning, there are lots of different procedures, techniques for this tape. Today's my presentation is based on the acupuncture meridian system, or called sport acupuncture meridian system. I'm using acupuncture meridian theory to taping. There are lots of the kinesiology taping, muscle energy taping, the neuromuscular taping. There are lots of different schools for tape, but I personally I feel this is the most simple procedure. We're using 12 meridian theory to apply the tape where the pen is, and the tape the most weakness place, and the tape from lower to higher, from the hand to the elbow, from feet to the ankle.
Thank you.
Thank you.有没有其他的问题 Do you have any question? I saw Joseph. Do you have any question? Oh, correct. Even Walmart have these tapes. Excellent. Excellent. That's a perfect. Yeah, this is a sport tape, a different kind of tape. Oh, thank you, Joe. So what's your job, Joseph? Yeah, it seems you have a lot of different tapes. Oh, so wonderful. I really appreciate. Next time you buy the tape from a Master Chen, they have the tapes. Yes, there are lots of pre-cut tapes. I do have all the pre-cut tape here. This for the lower back, for example. They already pre-cut and have a different manufacturer for this. Is already pre-cut. And have
这
a
个是
little.
新的哈，这个是新的比较是吧？
这是新的，去年的。
哦，哎，到我们那个会过期吗？你之前放在那边？
会的，3年，咱还没到3年呢，会过期的。不过过期就我贴角就行了。
啊，
它是5年的，5年过期。
5年过期啊，那还行。
它上面没有过，我们还有。
还挺多的，我们也不会销售，都在那儿。
本来如果没有 COVID 我去年就应该到你那儿上课去。
对呀。
If no COVID, I will be there last year, 2020, for have this workshop.
那今年争取来吧。
我争取。So is there English about text in English? This technique? Well, today's is there a text in
KT tape.
Hello, James. I don't understand your question, James. Is English a textbook? I do have the textbook in Chinese called Acupuncture Meridian Taping. I only have a handout, like this, a teaching handout. They're not in the textbook yet. Yeah. It's real simple procedures. I have all the, I have 5 lectures. This is just an introduction. Another 5, well, we call that KT tape. KT tape, little strong. Let me tell you why we're using this tape. This tape, same as a Lin, Master Lin or Master Chen have, is a very soft. Because when the people have injuries along the meridian becomes sensitive. So sometimes KT is a little too strong. So people may have a little blister or even have a little allergy. KT tape is a wonderful tape, very good. Is for the strengthening, will be perfect. But please remember, our meridian taping, we need relax, harmonize, eliminate. Again, we have 5 lectures. Today, just the introduction. Well, KT tape is the beginning, is perfect. However, remember, we, as a traditional Chinese medicine, the sport medicine, we not only support, sometimes we need a subsidize, we need a release, we need to harmonize. Good question, Miko. Thank you. Now, thank you again. Thank you, everyone. We have 1 hour lecture. It seems is the time. And do you have any question? We're looking for the Master Lin and the Master Chen.
非常好。Very good. Thank you so much, 刘东博士。
谢谢。
Appreciate. 欢迎你到纽约来。Welcome you to this year coming to New York workshop. Okay.
I will. I did 2 workshops 3 years ago. During the COVID, the border is closed. Well, all the best for everyone. Take very good care of yourself. And I hope someday we can see in person. We can tape in person. All the best. If you have any question, you can contact the Master Lin or Master Chen for the further information. And thank you and good evening and good night.
Thank you.
Thank you.
Bye bye. Thank you.
Thank you.
Bye bye.
谢谢。
谢谢。
Thank you everyone support. See you again. Good night.